Hello, I'm Dr. Geeth Monnappa, Senior Obstetrician and Gynaecologist, Laparoscopic Surgeon, SPARSH Hospital, Bangalore, India. Today we talk about a topic that is very close to my heart, prevention of cervical cancers. This is particularly pertinent because cervical cancer is probably the only cancer that can be prevented to a large extent. Cervical cancer is the fourth most common cancer among women globally. It is the second most common cancer in women in India. India is responsible for about 1 lakh cases of cervical cancer and about 77,000 deaths attributable to cervical cancer every year. India and China account for about 40% of the total number of cervical cancers detected every year. India alone is responsible for about 15 to 20% of the new cases of cervical cancers detected every year. Although we've seen a steady decline in the number of cervical cancers from the 1990s to 2017, we still have a long way to go. The decline has been largely attributed to better outreach programs, screening techniques that are available, and most importantly, the availability of cervical cancer vaccines or the HPV vaccine. Cervical cancer is the only cancer where we know the cause of the cancer. We do know that more than 95% of the cases of cervical cancer are caused by the human papillomavirus, out of which the strains 16 and 18 cause more than 70% of the cancers. The HPV vaccines available in India either protect you from two strains of the virus, HPV 16 and HPV 18, that are known to cause more than 70% of the cancers, or we have the quadrivalent vaccine, which protects you from 16 and 18 and 6 and 11, which are the low risk strains causing genital warts. We recently have the nonavalent vaccine, that is the Gardasil 9, which further protects you against 5 high-risk strains. HPV 16 and 18 are known to cause 70% of the cervical cancers, and in the Indian population, they are known to cause about 82% of the cervical cancers. So even the bivalent vaccine, which is quite reasonable, can offer you good protection against cervical cancer. When we talk about the quadrivalent vaccine, the nonavalent vaccine, Gardasil 9, it can actually protect you from about 90% of the cases of cervical cancer. Human papillomavirus, or the HPV, is known to cause more than 95% of the cervical cancers. So protection from HPV will largely reduce the incidence of cervical cancer. Why have we seen a decline in the cases of cervical cancer? In the past decade, we've seen a steady increase in the age of marriage, a reduction in the size of families, and these two are directly related to an increased incidence of cervical cancer. Cervical cancer is known to occur in women who get married early or are sexually active early in life, women who have multiple children, women with poor genital hygiene, and women who are not protected with the HPV vaccine. With the changes that we've seen in the past decade, with better outreach programs and better screening modalities, and with the advent of the HPV vaccine, we've seen a drastic reduction in the number of cervical cancers. India still is one of the leading countries when it comes to the number of cervical cancers, and hence we have to increase the awareness of screening techniques and the HPV vaccination. What is the right age for you to get vaccinated against the HPV virus? The ideal age would be anywhere between 9 to 14 years. Now, this is the ideal time to vaccinate your child or a young girl or even a boy with the HPV vaccine, because this is the time before which the individual is sexually active. Between 9 to 14 years of age, we recommend 2 doses of the vaccination 6 months apart. After the age of 14, 3 doses of the vaccine is recommended. The vaccine can be given up to the age of 26 or even afterwards up to the age of 45. However, if the woman has been previously infected with the human papillomavirus, the efficacy may reduce. Is the vaccine 100% effective? No. Even the nonavalent vaccine can protect you from about 90% of the cases of HPV infection. However, this is not 100% protective, and therefore screening modalities which mainly focus on early detection of cancer and precancerous conditions is extremely important. Cervical cancer is one of the few cancers where we have effective screening modalities that can detect precancerous conditions as early as 10 to 20 years prior to the cancer. This is why it's extremely important to be diligent with screening modalities. How do we screen for cervical cancer? The screening modalities available in India are the pap smear, the liquid-based cytology, and the HPV DNA testing. All three tests are extremely simple procedures. They require you to come to the outpatient clinic. It takes hardly 5 minutes to finish the procedure, and it is not painful. It's just associated with a slight discomfort, as is an internal examination. How often should one screen for cervical cancer? The most effective screening modality is the HPV DNA testing. However, it is also more expensive. If a woman opts for a HPV DNA testing, she needs to start screening from the age of 30 and repeat the screening once every 5 years, up to the age of 65. If a woman opts for a pap smear or a liquid-based cytology, then she needs to screen every 3 years up to the age of 65. Is it important to screen despite taking the vaccine? As the vaccine is not 100% protective, it is extremely pertinent that every individual screens herself for cervical cancer every 3 to 5 years with the above screening modalities. What are the symptoms of cervical cancer? When should you be worried? When should you meet your gynecologist? If you experience heavy bleeding during your period, or if you're bleeding in between your periods, if you experience any bleeding after intercourse, if you have foul-smelling vaginal discharge, if you have swelling of your feet, or blood in the urine or blood while passing motion, you need to meet your gynecologist and take it forward. What is cervical cancer? Cervix is, in layman's term, the mouth of the uterus. It's something that we see when we do an internal examination in the outpatient clinic. Cervical cancer is nothing but cancer of the mouth of the uterus. It is the only cancer that can be prevented and can be detected at a very early stage or even in the precancerous stage by effective screening modalities. The rates of screening in India, especially when we talk about the rural population, is dismal. It's disappointing to note that a study done recently in the rural areas of South India noted that only 2% of the population actually screened for cervical cancer. What would be the game changer in reducing the rates of cervical cancer across the nation? The availability of vaccines to one and all would drastically reduce the rates of cervical cancer. With the indigenous vaccine, Cervivac, which is manufactured by Serum Institute, Pune, we hope that the costs of the vaccine will drastically reduce and the vaccine will be available to one and all. This would drastically reduce the rates of cervical cancer. However, it's equally important for women to be regular with your screening programs and screen for cervical cancers with pap smear, liquid-based cytology, or if cost is not an issue, with HPV DNA at a regular interval to detect cancers early or detect precancerous conditions. Are the HPV vaccines only for girls? Human papillomavirus is also known to cause oropharyngeal cancers, genital cancers, and therefore can be given to young boys prior to the age of 21. What would be the warning signs that you look out for when it comes to cervical cancer? Any bleeding that lasts more than 7 days or is associated with clots, if you tend to be bleeding heavier than normal, if you bleed in between the periods or after intercourse, if you're experiencing a foul-smelling discharge, if you're feeling extremely fatigued or tired, if you notice swelling of the feet, if you have blood in the urine or in the stools, if you're having a persistent low backache, please meet with your gynecologist and take it further. Screen for cervical cancers every once in 3 to 5 years and protect yourself from the deadly disease.